Okay, well, welcome everybody. My name is Dr. Iain McPhee and I'm Academic Director for the into St George's University of London Higher Education Programmes here at St George's. So, I'm going to go into a bit more detail now about the structure of the courses. So, I'm going to start with the International Medicine BSc MBBS. So, the course we're offering here is innovative and is the first of its kind in the UK, with teaching both in the UK and in the United States, and perhaps other international clinical sites, but primarily UK and US. And the aim is to produce graduates who have experienced healthcare in different systems, and at the end of the degree course should be competent professionally and to practice medicine in a patient-centred, multi-professional environment. So we think we're going to prepare good, broadly experienced doctors through this programme, fit for contemporary medical practice. Quite a lot of information on this slide. So the course structure, and each of these boxes represents a year of the course. So during the first, so we've got high school graduates or graduates from our foundation programme come into the first year of clinical sciences. So during the first 3 years, students and the Into programme study alongside students on our local St George's courses. In fact, they're doing exactly the same course. They're mixed in, the teachers don't know which programme students are from. Years 1 and 2 very much focused on basic clinical sciences, and the third year of the course is what we call the transition year. And at this point, students from the school leaver stream and graduate stream actually join together and are taught together. And in the transition year, 50% of the time is spent on clinical placements and 50% of the time on problem-based learning. The fourth year is the BSc year, spent studying science in an area of the students choosing in more depth that can be covered in the earlier years and involves a research project. Years 5 and 6 are entirely focused on clinical attachments, and for students who can get a visa for 2 years to study in the United States, years 5 and 6 will be in the US. A lot of international students will only be able to get 1 year's visa for the US, so they will do year 5 in the UK and year 6. The current clinical site for year 6 in the US is Jackson Park Hospital in Chicago, but we're looking at a number of other exciting developments, and that will change with time and we'll have a broader range of US clinical sites. And at the end of it, the degree that's awarded is a St George's MBBS degree, and we envisage most students progressing into US residency programs. So this slide contains all of the data on the International Medicine MBBS course, and I'm just going to walk you through some of the detail on it, so we'll progress through. So the blue box here, so students either coming in from school with good A-levels or progressing from foundation. And clinical sciences year 1 and 2 in London, and as I said earlier, taught alongside all of the other St George's students. And year 1, we have a systems-based approach to teaching, and a lot of it is focused around case-based learning. So we bring the clinical context in right from the word go. And even in year 1, there's some clinical exposure. So there's some teaching and visits goes on in real clinical environments. So the course doesn't really split into preclinical and clinical. So you'll have contact with patients right from the word go. And I think that's a strength of our programs, that the basic science is in a real world context. In year 2, there's more case-based learning, and a lot of teaching in small groups, tutorials and group activity, and clinical and community visits that are arranged by the clinicians that are involved in the teaching. Progressing through to the third year of the course, 50% of the time spent in clinical rotations, so a 6-week block in general internal medicine, a 6-week block in surgery, and a 6-week block in general practice is what we call it in the UK, or family medicine would be the North American term for that. So it's relatively early introduction of training on clinical placements. And it means that all students will have seen some real clinical practice in the UK before going to the United States. Year 4 is Biomedical Sciences BSc year. That's taught alongside the Biomedical Sciences programme. So students effectively step out of the medical programme onto the Biomedical Sciences programme for that year. And there's a choice of 20 modules of advanced content, and it's all based on research, and the teaching staff for this course are all research active faculty within St George's. An aspect that students really enjoy is the final year research project, where there's the opportunity to do some primary research supervised by one of the faculty at St George's, and a lot of students have actually managed to get publications or presentations and meeting out of the research that they generated. And at the end of it, there's the award of a Bachelor of Science degree to successful candidates. There's obviously an exam at the end that has to be sat to get your degree. And then there's progression into the last 2 years of clinical training, which for those who can go to the United States, both years in the United States, those that can't, the year 5 is based on UK clinical science, the same as our local students at St George's, and then the final year is into the US. So clinical rotations, small amount of lecture teaching during this period. It's mostly practice-based learning, and during the final year there are 2 opportunities to do student-selected study. So during the year there's a 5-week block called the student-selected component, where you can study what you want to, pretty much related to medicine, and geographically you can go anywhere. So it's an opportunity to visit somewhere interesting. And then right at the end of the course there's a 6-week elective opportunity, but again it's driven by student choice. And at the end of it, qualified as a medical doctor, and the degree is MBBS. Okay, so just to run through some details on coming onto the course. Starts 22nd of September 2014 for entrance for the next academic year, and the fees are £29,000 per year. Entry requirements, entry is competitive, so it's high achieving high school students that we're looking for to come onto this course, so equivalent to 3 A's at A level, international baccalaureate, 6's at higher level, including biology, chemistry, English and mathematics, and one of biology and chemistry must be taken to HL. There's also a reasonably high bar at English language testing, requiring an IELTS score of at least 7, with 7 in written and no sub-skill below 6.5. The entry is not just based on high school or foundation academic performance. We also require one of the aptitude tests, and for UK CAT we need a minimum score of 500 in every section. There is also an interview process, and we were doing this by multiple mini-interviews, and I'll talk a little bit in a few slides' time about what the multiple mini-interview is and ways of dealing with that. It's a 6-year course that gets both a medical degree and a BSc degree, and the study, the country where study takes place, 4 years in the UK, and for those that can get a visa for 2 years to the US, 2 years in the US. For those that can't, second last year, penultimate year in the UK. Now, additional requirements. In applying for medicine, we're not just looking for people who are academically able. We're looking for people who've got a broad range of interests and attributes that will prepare them well to function as doctors. So, extracurricular activity, it's really essential for a career in medicine and healthcare, where what you're going to be doing is working with human beings in stressful situations. So, we like people who are well-rounded, and that's something that will be brought out at interview. So, extracurricular activity, essential career in medicine and healthcare, may inform what your ultimate career choice is, and would encourage people to get healthcare-focused work experience, to actually know something about what healthcare is before applying for these courses. You may find, yeah, this is great, it's what I want to do, but occasionally people will find that in reality it's not for them, and they're better to do something different. interview, we'll expect students to have demonstrated learning from their experiences and to reflect a bit on the healthcare that they've seen. And a whole range of experiences can be relevant, so not just in hospitals, so things in a community setting, community service, very much relevant to working in healthcare. And it's very important that students actually reflect on these experiences, and we'll be looking for that, not just that I spent 2 weeks working in a nursing home. We want you to reflect on what that meant. What did you learn from it? So the UK Clinical Aptitude Test, or UK CAT. So there's a variety of aptitude tests, and this is the test that we use for high school graduates or foundation students progressing on to undergraduate medicine here. It's an online test delivered at centres in the UK and internationally, and key dates to note for registration this year: testing begins 1st of July to the 4th of October, and the web address for registration is shown there. A number of attributes that are tested here, so verbal reasoning, quantitative reasoning, abstract reasoning, and then decision analysis and non-cognitive analysis. Variety of different testing times, and students have to score reasonably well to be competitive. An alternative that's a US-based assessment is the Medical College Admissions Test, and this is designed for graduates as an alternative to GAMSAT, so we'll accept either MCAT or GAMSAT, whichever is preferable to the candidate. And with the MCAT test, there's a grade requirement of 24, and the web address is shown here to register. And it's multiple choice questions testing a number of different areas. So there's basic science knowledge, physical sciences and biological sciences, but also verbal reasoning and language writing skills. The multiple mini-interview is a component of the selection process that I think students, candidates find most difficult. So everyone before getting this stage has to have met the minimum academic requirements. And the multiple mini-interview, we're really looking to identify the attributes that will equip a candidate well for medical training and equip them well for a future career as a doctor. And there's a number of different domains or attributes that we're assessing through the interview stations. So we're interested in empathy, initiative and resilience in response to scenarios that we'll ask you about, communication skills. If you can't communicate, you can't work as a doctor. Insight and integrity, again, absolutely essential for anyone in healthcare. And nobody ever works in isolation in healthcare. You're always part of a team, so we need individuals who can work within a team and demonstrate that they understand something about how teams work. Organisational problem solving, in some respects that's what you're paid for as a medical professional. You have to solve problems and organise systems to help you solve them. Academic ability and intellect, we've assessed that by academic grades through high school or foundation, but also how you respond to the stations of interview. And a bit about learning. Medicine, we're aiming to train lifelong learners and to ensure that people have got an approach to learning that will enable them both to be successful in the degree course, but also to continue to learn afterwards. Now, the way the interviews work is that there are different interviewers, and the candidate moves through a number of stations where they're given a specific problem or scenario to address and to talk back to the interviewer. Now, the stations will each assess a number of these different attributes. So it's not that we've got one station that's looking for empathy and another station that's looking at language style. So a number of different interviewers, and your performance in each of the stations is scored, and you end up with a cumulative score at the end, and there's a threshold that students have to exceed in order to be eligible for entry. So an example of a question that you might be given in the multiple mini interviews: how would you answer the following? So a practical problem. It's not medically related, it's just a life skills type issue. So you're travelling in the London Underground, and one of your friends has become separated from the group. The first time in London, describe your plan of action. So the student then has 5 minutes just to talk through exactly what you would do. And again, another example here from sport or an extracurricular activity. Captain of the football team, former member of your team, but they've not been selected to play in the final. So there's a bit of empathy, breaking bad news, leadership skills coming into that. Right, so just to close up, I'd like to thank you very much for your time and attention going through what's been a lot of information here. If you do have any further information that you need from us, we'll be organising a follow-up session where you can ask questions, and you can contact us at any time if there's specific questions that you want to ask, and we'd be more than happy to answer them. Thank you very much.